is part 6 of neuroanatomy. If you continue the carotid triangle, here you can see the two major vessels. This external carotid, internal carotid. These are branches of external carotid at the level of thyroid. The lowermost is thyroid artery. Superior thyroid artery is a branch of external carotid artery. Then you can see inferior thyroid is from the thyrocervical trunk. It's not this. So second is the lingual artery. Then third is the you can see parotid artery. This maxillary artery. So let me see. First we will go to that exactly to cover this branches of external carotid artery. Sorry, it's a facial. So thyroid, superior thyroid, lingual, facial, maxillary. So it has to be like this: maxillary, max MFTC, MFTT, MFLT. Maxillary, facial, lingual, thyroid. You have to remember it is going in the face. This is towards the face. Anteriorly 4 branches going towards so it's going towards the face, and this like this. Superior thyroid, lingual, facial, maxillary, and superior temporal. Posteriorly ascending pharyngeal artery. So if you see, so this was about the important part of this muscular triangle. Here the question things are, these important questions are: contents of the carotid sheath. Carotid sheath is having CIV, internal jugular vein, vagus nerve, and common carotid artery. The most commonly nerve injured is during this is the question regarding endarterectomy. Hypoglossal nerve is commonly injured. Vagus nerve in branches causes soreness of the voice, deviation of the tongue. Vagus nerve, other nerve sympathetic causing meiosis due to intact oculomotor while injuring sympathetic unsuspicious glossopharyngeal. These are the major vessels. You can see this is the nerve passing transversely. You can hypoglossal nerve is just crossing like this. So when you are applying clamp to this arteries, this nerve vagus going down in between the jugular vein and the common carotid. If it is injured, damage will be there, and this is lower is ansa cervicalis, there is hypoglossal nerve. So this picture you have to remember. Then this is procedure of endarterectomy. Your 2 clamps are applied in between. The thrombus the vessel is cut and thrombus has to be removed. So now this is the muscular triangle. This is the anterior triangle. You can see suprahead and infrahead. Infrahead muscular stops are the psoas muscles. Supra is thyro. Superficial. Now if you can go see this superficial sternohyoid, from sternum to hyoid. This is sternum bone, this is hyoid bone. Most superficial is sternohyoid, long. Then deep you get thyroid cartilages in between hyoid bone, cricoid cartilage. So thyrohyoid will be below. Sternothyroid, sternum to thyroid. From sternum to thyroid, one muscle. From thyroid to hyoid, one muscle. So thyrohyoid, sternothyroid. And then above this there is another muscle that is called as sternothyroid or sternohyoid. Superficial is sternohyoid and omohyoid. So sternohyoid, omohyoid, sternothyroid 2, sternohyoid, omohyoid, sternothyroid, thyroid. So thyroid is, you can see this is the hyoid bone, this is the thyroid, and this is the sternum. So from sternum to thyroid, thyroid to hyoid bone, to thyroid, sternothyroid. Above this is sternohyoid. Nerve supply, all the muscles are supplied by ansa cervicalis except thyroid muscle, which is muscle supplied by C1 and the hypoglossal. Along with that, hypoglossal is there. Depress, what they do, infrahead muscle, they depress the head bone during swallowing. So this is the strap muscles, again 4 strap muscles. This is ansa cervicalis. It is starting from C1, C2, C3. 1, 2, 3. They together join and form a loop downward, and they go like this from below upward. So that's why all the strap muscles are supplied from ansa cervicalis from down. So that's why muscles, when they are cut during surgery, it has to be cut in this manner. It has to be cut at the upper level. Whenever you are doing thyroid surgery, it's done at the level of thyroid or some anterior neck surgery, you should not cut it downward, so it loses nerve supply from below. So muscles are cut from above. So you can see hypoglossal nerve is passing way beautifully down, and this is the lingual nerve. So these are supplying to the intrinsic muscles of the tongue. Lingual nerve is supplying to the taste sensation from the anterior side, and C1 is mixing with the hypoglossal nerve to supply thyroid T muscles, thyroid from thyroid cartilage to the hyoid bone, so that is thyroid. Other stap muscles are cervical, supplied from the ansa cervicalis. Now ansa cervicalis formation, superior root origin from C1, inferior root from C2, C3. All the stap muscles except T is supplied by C1 and along with the hypoglossal. So about the thyroid gland. Now you coming to the thyroid gland. Important questions. Why thyroid moves up with the deglutition? Thyroid gland present with the pretracheal fascia. This is the question. Pretracheal fascia, which is attached to the thyroid cartilage and hyoid bone. So whenever the movement of this there during deglutition, because of pretracheal fascia, it is enclosed. It moves up with deglutition. When digastric muscle contract, it pulls the hyoid bone upward, so which pulls the thyroid cartilage, which pulls the pretracheal fascia and its contents. That's why this leads to movement of thyroid gland with deglutition. The important terms are superior laryngeal, recurrent laryngeal. Superior laryngeal from above, and it is also called have the branches external, internal. Whatever you get external, superior, all these are with the superior laryngeal. It is any injury to this called first footing, and this called singers. For singer's voice is gone because of superior laryngeal. And recurrent laryngeal, it is basically supplying for the breathing close to the inferior thyroid artery. So it is superior laryngeal is close to superior thyroid artery. So whenever there is ligation is done, if you see this is superior thyroid nerve, external laryngeal nerve or superior laryngeal nerve divided into external and internal laryngeal, it has to be done very close to the gland. If you go away, there is chance of injury. So close to gland, superior is close and inferior is to be done away. If you try to away, it is little bit separate. So that's why this is it is a branch inferior thyroid. This is a branch of brachiocephalic trunk. This is subclavian. First subclavian gives thyrocervical trunk. From there they are supplying inferior thyroid artery, thyrocervical, and this is from the external carotid artery, superior thyroid from the external thyroid, first branch from the, here you can see there is division of this and then it's supplying. So if you see, this is the manner